You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, dental implants, replacing missing teeth with dental implants. According to my first guest, he says, and we've had him on the program before, he says nobody should be wearing a loose-fitting denture. With us, we have board-certified prosthodontist, Dr. Pharr. Dr. Pharr, welcome back to the program.
Thank you for having me back. It's a pleasure to be here.
I think it was over a year ago.
That's right.
Is that right? And you say just about every single work day, you're helping people get their teeth back. I mean, you have a busy practice.
That's correct, Randy. Every single day that I go to work, I meet a variety of people that come to our center looking for an ability to change their lives, to improve their lives using dental implants. And we've been very busy in Austin. We see people 4 days a week that come in with all kinds of stories and all kinds of visions and hopes of how we can improve their life with dental implants.
But is it true, by the way, that somebody on the day of the procedure, when they finally get to the day of the procedure, that they could walk in without teeth and they walk out with teeth that don't come in and out?
I sense your skepticism there, and it's a common question we get in the consultation process and actually every single step until it happens. So I get this question a lot. Are you sure this is going to happen? Are you sure you can do this? And the reality is, in the overwhelming vast majority of our patients, we are able to give them fixed teeth in 1 day. And
okay, good.
I've done the math in our own practice in Austin, and it's over 99% success rate.
For your patients?
For our patients. I tallied it up over the past year, and that's what we've been able to achieve. And I'm very proud of that, and we've really helped a lot of people with their lives by using dental implants.
Okay, good. Now, for people that don't know your center, ClearChoice, I guess this is all you do, is implant dentistry. Is that right?
That's right, Randy. That's what we've focused our practice on. We have myself, a prosthodontist, an oral surgeon. We have 3D imaging, and we're all in the same office, and that's what really makes us unique.
Okay.
And additionally, we actually have an in-house dental lab. So all the aspects that are needed to do the type of dental implant care we provide, they're all in one center. And so it really makes it convenient for the patient. And just as important, it allows for excellent communication for all these different moving parts, because to provide people fixed teeth in 1 day, well, it's not easy. There's a lot of parts involved. And when everyone works in the same office building, we don't have to try to call someone and go get them on the phone and wait for a return call.
Like another doctor you're referring to.
Exactly.
So you guys are all right there.
The communication is excellent. And and we're able to hold each other accountable. What it does is allows us to work in a team approach to the best that we can.
Now, you work a lot with, I mean, the patients that come in, a lot of people either headed to dentures, as you say, or people that already have dentures.
That's right.
Are there a lot of people where you are that have like an upper lower denture? I mean, are false teeth that common is what I'm saying?
I understand your question, and that's one thing that's been a major revelation to me over the past year. As I was just saying, I've been practicing over 10 years, but this past year at ClearChoice has really opened my eyes to the number of people in the Central Texas, Austin area who are in need of this type of care.
So there's a lot, like tens of thousands of people with an upper lower denture?
Well, I can tell you, I like to use analogies when I talk with my patients. You know, just it helps for really clear communication. In Texas, I would tell you we could fill up a football stadium, and whether it's high school, college, or professional, they're all the same size in Texas. But you could fill up a stadium with the number that currently need it now. And that's not even including the people that will need it in the future. So yes, the demand is very large.
So if it's so good then, and there's so many people, right, wearing an upper lower denture, why aren't they all doing it? Why aren't they all coming in? What's your take?
Well, I've learned a lot from our patients, and what I've found is there's a number of reasons. And one of those would be that a denture wearer is essentially, they're out of the system. They're not seeing the dentist regularly. They no longer go back. And think about what their life was like when they were in the system. They eventually ended up in a denture. So they had many fillings, root canals, cleanings, extractions, lots of dental work, and they still ultimately ended up in a denture.
Like very expensive.
Lots of time, money, and effort on everyone's behalf, and they still ended up in a denture. So for a lot of people, they get to a denture, and it's, to use another analogy, it's like crossing the finish line of a race. They say, I'm finally done going to the dentist. So a lot of patients tell me that once they got their dentures, it was like a double-edged sword. They were sad to have lost their teeth, but at the same time, they were very happy to not have to come back to the dentist. And it's a reality that I've had to learn through my patients, and it's a very powerful statement. So they cross that proverbial finish line, and they come back maybe for an adjustment or a reline here or there, but eventually they just check out. So for those patients, what's really interesting is what brings them back in isn't themselves. It's a family member or a spouse or a child or sometimes another friend that's a denture wearer. So
that had the procedure done.
Not that they've had the procedure done, just somebody else that's also in dentures, or somebody that's close to this person that watches them struggle with their dentures. And they may watch them eat a meal and maybe curse at their dentures while they're eating.
Is that right? Is that what they tell you?
Absolutely. They may take the denture out halfway through the meal and just try to swallow it. That's something I hear every day. I just swallow my food and now my stomach hurts. And so these people struggle with their dentures. And somebody finally confronts them and says, you need to do something about this.
So they bring in their friends and family.
That's right.
On the consults?
Right. So,
you're okay with that?
Oh, we love that. We love the family support or the spousal support or the friend because the more support we can build to show our patients that we're all on the same team, we're all trying to improve their lives, the more likely they are to move forward and go ahead and improve their lives. Back to your question of why denture wearers are maybe not coming in is the reality of the society we live in today. While you and I are talking here, and this is on TV, somebody is going to be on their phone or their computer, and they're going to be looking up how much does a dental implant cost, right?
So they're worried about
That's
cost.
what happens. That's how we all function now. So somebody may really have a strong interest, and they're going to search or look up how much does a dental implant cost. And in their mind, they're likely going to say, well, at one point, I must have had at least 20 or more teeth. So they might find that number, multiply it by 20, and that's enough to buy a house where we live.
Yeah.
And so, understandably, that's a major barrier for a lot of people, as they just assume that dental implants are so high priced that no one can afford it.
Is it true you're only giving them, like in most cases, like 4 implants with a full arch of teeth that don't come in and out?
And you hit the nail on the head. That's exactly what we do in about 99% of our cases. We use 4 implants to do a full jaw of teeth, or 8 implants if you're doing your full mouth. So as you could see, it really is a very cost-efficient way of providing a smile for someone. And another reason that holds people back from doing this is they may think, I'm too old to do this. Do I really want to make this investment in myself at this age?
How old can you be to do this?
We currently have 2 patients in active treatment that are well into their 90s.
So why would a 90-year-old want to do this?
Bottom line, they want to eat and chew. They want to eat the foods that are in front of them. They want to eat the foods that they want to eat. And think about when you're with your family members, when you're with your father, what do you guys do together?
Yeah.
You like to eat?
My dad's 81 years old.
Yes.
Everybody's bringing him food.
Right. That is usually the centerpiece of getting together with your family is, what are we going to eat? And so that's a major motivator and a great reason to do this.
Every time I smiled, I had to cover my mouth because I was so ashamed. When the denture slipped, I would have to excuse myself and go to the restroom virtually in tears. It kept me from being able to speak properly. I could not eat corn, apples, baby back ribs. I did not want dentures to be part of my life. I pretty much decided ClearChoice was the route I was going to take.
Let's do a head-to-head comparison of dental implants versus dentures. With dentures, the ability to taste food, to bite and chew is altered. The worst thing about dentures, bone loss. When you put an implant inside the bone, which is like the root of a tooth, now you preserve the bone. It's a game changer. With implants, you walk into a restaurant, you order anything you want. You eat just like you have real teeth.
Before you knew it, here I was with my brand new teeth.
Schedule your free consultation today. We'll even talk about financing options.
I can smile, my confidence is back.
Call ClearChoice today.
Now you say you're changing people's lives. You brought some photos. What are we looking at?
We have some great examples of patients we were able to help this year. I'm very proud of these particular stories, and so let's review them together.
All right, let's take a look.
All right. The first patient we're going to talk about
All right.
is an amazing woman that I've gotten to know. And what reminds me, when I think about our journey together, I always go back to our consultation process. And she kept looking me in the eye, and she kept saying, are you sure? Are you sure? And I'd
Sure
say
what? That you could give her teeth that don't come in and
right,
out?
that she had enough bone. She was told she didn't have enough bone for dental implants. She wasn't a candidate, and she should pursue dentures.
Okay.
or just hang on to those remaining teeth for as long as she possibly could. But when I got to know her, these teeth were causing pain. They were causing her to be uncomfortable. She couldn't eat her food, so she knew she had to do something. She just really wanted me to reassure her that it could be done.
So on the console, she's looking at you.
That's right.
And just saying,
right. Are you sure? Are you sure? She was on board. She knew she wanted it. She just needed some reassurance. And so getting to the end here, here's her final photograph from just recently. It was really a fun. It was very much a fun experience to be able to look her in the eye and just have her say, you know, I wasn't sure, but now I'm sure. And she's able to eat all of the foods she wants to eat. She likes to eat healthy foods, so she can eat carrots. She can bite an apple. She can choose the salads.
Can she bite an apple with her front teeth?
Sure,
really?
Absolutely.
Okay.
Yes, and I know this because she tells me. So, that's just a great example of. It's very often that someone comes in and says, I've been told I don't have enough bone. So they're skeptical if they're even a candidate. But when we look at the 3D image, they do. And so we know we can help them. And this is a very important point because 3D imaging isn't just readily available.
Is this the advantage with working with an oral surgeon and the prosthodontist?
It's a great example of by having everything in one facility. So if I have a question for the surgeon, I go ask him. If I have a question for the lab, I go ask him or her. And so it is a good example of how the communication helps the patient. All right, and there's one other thing with this particular example that I want to share. We talked about the chewing and not being able to eat, but just take a look at the smile. Just look at the face.
Looks natural.
Look how happy she is. Look how happy she is with her result. It's so nice that people come back and they say, look at this photo I took with my grandchild or my spouse or my friends, and they're the, you could put a spotlight on them in the picture that had the best smile in the photo, and they're very proud of it, and so am I. I'm really proud of what we're able to accomplish.
So a lot of patients, a lot of your patients,
yes,
they don't smile, like in photos, before, like when their teeth are back.
That's right, that's right. Can we show you another case?
Yeah, let's take a look.
This is, you kind of led perfectly into this particular case. This is a really amazing person.
He looks pretty serious.
Yes, and there's a couple particulars about this story that I'd like to share. One is, as you can see, he just didn't smile, right? So just hiding those remaining teeth, just hanging on to like those last few teeth here and there. And so really prevented him from smiling and being outgoing and having fun with his friends and at his job. And what he shared with me was extremely powerful. He had what he said his best friend approached him and put their friendship, their relationship on the line. And he says, you have got to do something about your teeth. The time has come. I've watched you, work around these teeth or hide them, and I'm just sick and tired of watching you live this way. You have to do something. And sometimes that's what it takes. And what my friend here explained to me is he said, my best friend put our friendship on the line. He risked me saying, I'm not going to associate with you anymore. I don't want to hear that. And so he put it on the line, and he came in to see us. And, well, there's a good reason why he was not doing it. He was extremely afraid.
Okay.
He was deathly, so as scared as you can be, and people have good reasons to be afraid of the dentist for past experiences or whatever it may be. So it was not an easy process just for him to come into the consultation. And so that's why he's not smiling in those photos. It's not that he's not a happy person. He's just very afraid. And one afternoon, this gentleman's life is changed, completely different. His outlook on life, the way that he smiles at his friends.
That's a good-looking smile, by the way.
It's amazing. And
they look like veneers.
They look completely
are they
natural.
Like veneers or something?
It's what he wanted. He wanted a beautiful, natural smile. And that's what we were able to give him. So his brother was with him on his day that we changed his life and gave him teeth again.
Okay.
And I'll never forget what I heard his brother say to him. He looked him in the end, his brother, the patient's crying, his brother's tearing up, and he says to him, I have not seen you smile like that since you were in grade school. And
that's nice.
And that's something that moves us. That's why we come to work. That's why we do these things. It's a powerful statement to see someone go back to that kind of youthful smile and maybe almost have their potential unlocked. They get to kind of
good. Because their whole charisma, right, is tied to smiling,
absolutely,
and talking.
Yes.
and those kind of things. And these people don't smile a lot of times, you say.
Yeah, and you better believe he's got a good friendship with his friend that pushed him to do it. You know, because I think without that nudge, I don't know if he would have ever done it.
Do they think I should have done, I mean, do they ever tell you, like, you know, I should have done this a long time ago? Because people have because you've told me in the green room, people have a tough time investing in themselves or doing a nice thing for themselves.
The two most common reports I get when we finish and we're all done, and I sit somebody up in the chair and we high five, we hug, we shake hands, whatever it may be, is I thought this was going to hurt worse, and I wish I would have done it sooner.
Okay.
I mean, it's got to be 9 out of 10 times. I feel like it's something that I hear all the time. So, and what else is interesting about that is these same patients will tell me, you need to tell your consultations this. You need to tell them, stop waiting. You know, we've had open houses in our center where patients have completed this treatment and they're volunteering to come talk to people that...
Talk to other patients?
Yes.
Really?
They become almost like ambassadors for our practice, and it's something they ask us to allow them to do. So we will get everyone together, and they can ask them questions about how they adapt, how they heal, did it hurt, all these questions.
A lot of eating stories?
Lots of eating stories, and it's an example to kind of showcase what it looks like. So you get a real life example, because there's always questions that people have that sometimes an existing patient can really help us answer. All right, let me show you this next patient.
All right.
All right, and what's special about this gentleman is there's special parts of every single person we get to help, but I remember the day that we were able to change his life by giving him his teeth back. And I remember we walked him out to his car to go home with his family, and it was almost like his smile was stuck to his face. he just couldn't stop smiling because we had handed him a mirror about 15 minutes earlier, and I think it exceeded his expectations and what we were able to do. And
so on the before photo that I'm looking at, so those teeth probably, they had to be like extracted.
Yes.
He was headed to dentures.
That's right.
And
They're
instead
causing him pain. They're loose. They're painful. I think when he woke up in the morning, it was, which tooth's going to hurt today? That's something I hear all the time, is when people have a mouthful of dental problems, they don't know which tooth's going to hurt, because it will kind of be the left side one day, the right side another day, the top one this day, the lower one another day, and that was him.
So one afternoon.
One afternoon.
This is what he gets. I mean, they look good. I mean, you're the prosthodontist. Are you the guy that, so the oral surgeon in your practice does the surgical part, and then you design the teeth to make them look good? That's right. Is that kind of what you do?
There's a lot of moving parts. It's a team. Think about it. I'm kind of like the quarterback of the team. I know where every part and piece is moving, and I'm in charge of making sure it's all functioning smoothly. And they end up looking like that. So that's what my job is.
So when this is all done, so he's smiling, it's glued to his face.
Yes. And he said, and I told him, we talked about this. I said, I'll never forget the day you left. It's almost like we'd stuck a smile on your face. And he said, I was just so happy. And he said, what was funny was I was looking in the mirror in the car on the way home. And he said, but my wife and my mom, they cried the whole way home. They were so happy, and they missed seeing that smile. You know, that's I think what I hear so often is the spouses, the family, the loved ones, they miss seeing the smile. They miss the emotion, because when you don't have your teeth, or you're missing teeth, or something hurts, you just kind of scowl. You're less approachable. You don't engage people. You don't start conversations as much. It just changes everything.
Well, definitely, look, as I look at this, because I've told you in the green room, I always feel like you're exaggerating about these results. But when I look at it, he does look younger, more sophisticated, healthier, happier.
This guy
He's a more handsome guy. There's no doubt about it.
He's a successful person in the construction industry. So this is a guy who's told me at work he's more confident talking to his coworkers, his bosses, everyone on his team.
There's a way to improve your overall health by addressing your dental health, the ClearChoice way.
My cardiologist said, I don't want you to come back and see me again until you start getting something done about those teeth. That is the foundation of good heart health.
We're doing amazing transformations, and it's not just a smile, which is huge. It changes the person's total outlook. Function is better. Chewing, if you can chew your food, you're going to be able to chew better foods.
Most patients don't realize that their dental challenges can lead to serious health challenges. At ClearChoice, we understand that your dental health impacts your total health.
Feeling good and knowing that you're doing the best for yourself and for your own personal health, that is what's important.
Not just another dental procedure. This is a true life changer. The ClearChoice way. Call today to schedule your free consultation.
All
Good,
right.
we have time for a couple more.
Let's do this. Okay.
All right.
This one is really, really
It's like you're showing me
powerful.
baby pictures.
Well, I'm really proud of them, just like
Okay.
my kids.
All right.
And because we're kind of one big family, honestly. We get to know each other so well. So here's an amazing woman, and her request is to be able to eat better. That's what it's all about for her. She's function. Yeah, she wants them to look nice, of course, but she wants to eat. And she's told us that when she goes to eat with her friends, she is the last one to finish her meals. She's not able to pick the certain items on the menu that she'd like to pick, like the healthier items, you know, try to get her diet where she wants it. And so she's kind of got two things going on, socially and just functionally and healthy. You know, she's not able to eat the foods she wants.
So in that before photo, this woman, those teeth couldn't save.
That's right. She had, that's correct. She could not save those teeth. We gave her all of her alternatives. One's going to a denture, and she said, no way, not going to a denture. And she's been extremely thrilled with her outcome.
Wow, look at that.
So for her, she's the healthy eater she wants to be. She's eating the food she wants. She's eating that salad with the carrots, the celery, the croutons, the nuts, you know, whatever she wants, and she's not restricted by her teeth.
All right, and she just cleans them. I mean, all of these patients, they get these full teeth that don't come in and out.
That's right. That's right.
They just go to the dentist every 6 months or so, 4 to 6 months, get them clean.
Yep.
That's it.
And what I've been told is it's now fun to go back down the toothpaste aisle. So a lot of these patients,
Really?
it was kind of a chore, and it reminded them of how much their teeth bothered them. And so now we give them these new teeth, and yes, they brush them with toothpaste and a toothbrush, just like you and me. We teach them how to clean them. It's pretty simple maintenance.
Okay, good.
Okay, ready to talk about another one?
All right, all right.
Here we go. I'll show you a before picture here, and as you can see, this is a scenario where, that's right, he just could not hang on to those teeth. We're talking about cavities, teeth that need to come out, and this is another example of family support. I'll never forget his consult because he came in with his family, right? And so it's so encouraging to see that when you have a family member that's helping you make this decision to improve your life. And as you can see in the final picture, I mean, look at that smile.
These are in one day. They get these teeth in one day.
He left on the same day with those teeth. And I love seeing him because he's another one of those people that has the smile almost stuck to the face where they never stop smiling, and just so appreciative of the atmosphere and the environment and the compassionate environment that we provided for him. And it's been a great thing for everyone. Okay, I got another great one. This is a really fun one. I was excited to come talk to you about this. Okay, so there's our before picture, right?
Yeah.
You can see missing teeth, failing teeth, doesn't want to go to a denture. So she's an adventure seeker. She likes to be outdoors. She likes to do things outside. And it's amazing that I didn't understand this, that having problems in your mouth prevents you from maybe doing things outside with your friends, or it's just kind of signing up for events or committing to things. You're a little more withdrawn sometimes when your teeth are bothering you. So we get to see each other at our 2-week after.
So she has fixed teeth now.
Now she's got fixed teeth.
That's
right.
Okay.
One day, fixed teeth. And as our normal protocol, we'll see someone about 10 to 14 days afterward to make sure everything's going okay. And she comes back, and she kind of has a little smirk on her face. It's something, how you been? What's going on? Are you having any pain? And she tells me she's been whitewater rafting in the 2 weeks from her surgery to her follow-up appointment, which is just phenomenal. That was a first for me. And I think it really just shows her inner desire to, that's who she really is. And when we gave her teeth back, she was able to be herself again.
Now you guys call it as an expression, like the third set of teeth. That like dental implants can be the third set of teeth.
That's correct. And what I hear routinely is, these are my teeth. These are not prosthetic teeth or implant teeth or fake teeth. These are my teeth. And I like that. I support that approach because they are their teeth. Okay, so I want to show you something else.
Okay.
I know we're running out of time, but there's a couple really good ones here, okay?
Good.
So snap-in dentures. They're everywhere. They're all over the place. Implants that snap in and snap out the teeth, okay? It just doesn't meet the expectations of so many people. That's the reality. It may start out good, it may theoretically work, but so many people want something that's more like their natural teeth, something they don't take in and out. They don't want to take them out to clean them. They want to brush them. They want to go down that toothbrush aisle again, toothpaste aisle.
So she had a snap-in, snap-out denture.
Correct. and she wanted something that did not come in and out. The snap in and snap out just didn't cut the mustard for her. And her wish in her life is to have fixed teeth again.
Okay.
And it's pretty simple. You know, she meets us and she says, "I want fixed teeth. Can you do that?"
All
and we say, "Well, you've come to the right place," because that's all we do. So we were able to cross the finish line with her, and it's been extremely rewarding for everybody.
Looks very nice. And by the way, we should mention, most of these people are getting some sort of IV sedation, and they're relaxed during this procedure. Is that right?
We have major priorities set on both safety and comfort. Okay, so we're always safe when we're working, but we always by working with oral surgeons, we're able to keep people comfortable, keep people relaxed. It helps get them through the process.
Good.
Okay, well, we have one more. Would you like to see the last one? Okay.
We actually have time for one more.
Okay, all right, great. Now, I'll tell you, the picture kind of does all the talking on this one. You know, great looking guy, just had lots of problems with his teeth, never really had the smile and the bite he needed, and he wasn't going to accept going to a denture. He knew he was headed that way. He's just not going to accept it. He wants fixed teeth. He wants what we have, okay?
Right.
And as you'll see in the final, I mean, just...
It's a very nice smile.
we just knocked it out of the park. All of us, him, it's a big team. It's everybody participating. You know, we're designing this smile together. We want to give them what they want, and that's what he wanted, and that's what we gave him.
Okay, good. So no more dentures, no more traditional dentures.
We don't have to do that.
You could come in there, and a lot of people see you on our interview, right? On TV, and they still come in skeptical.
That's right.
You said.
That's right.
Like, are you sure, doctor? I mean, really?
It's a very common question we get in the consultation process, is just for whether they've been told they're not a candidate or they just don't understand exactly how it works, and that's the beauty of the consultation. We offer a free consultation. We spend an hour with our consults showing them what we do. They get to see our center. They get to see us in action. They get to meet me. They get to meet everyone they want to meet. And we help answer those questions so there's not that skepticism or that concern. They start to really see the light that this is happening in front of my eyes. You know, once you see it, it's proof.
Good.
And so when they come see it, they kind of buy in, and that helps get them to where they want to go.
We're out of time. Good stuff. And I know all this is on your website. Is that right?
That's correct.
Okay. For somebody watching this, final message. Maybe they're headed to a denture, or they're already wearing a denture. Maybe they've been in a denture 20 years. What do you say to them? But they're still skeptical.
They need to come in and see us. They need to kind of learn what their options are. They need to understand exactly how we can help them. It'll be a custom consult. We'll get to know them, and just as important, we understand their vision and how this is going to change their life. It's not just the dentistry, it's what they want to get to in their lives, and how by giving them a smile back, it helps get them there.
I want to thank you for coming to the show. Thanks for coming back, by the way. Good stuff. And thanks
Thank you
for
so
bringing
much for having me.
the new photos, and keep up the good work. So
Thank you for having me
appreciate you on the
here.
show.
It's great to get the word out, and hopefully we can help more patients in Austin.
Okay, good. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.